Hi friends and subscribers. So today I'm showing you the scan of a polycystic ovary case. So over here on the screen you can see we have two ovaries. One, this is the right ovary and here is the left ovary. We are 5 days into stimulation of the patient. First I will show you the uterus and its lining. Okay, so here you can see that this is the lining of the uterus. You can see there is a triple line endometrium which is forming right now. There is a center line, upper line, lower line, and let's see the blood supply. You can make out very beautiful blood supply that the uterus is taking at the moment. Okay, can you make out over here? So this is very good blood supply that you are seeing on the screen. This is my cursor. You can see that the blood vessels come from outside and they give the blood supply till inside. They are touching this line, outer line, and sometimes you see that there are some spots of color inside. This means that this uterus is having very good blood supply, and if this uterus is given a baby, there is a very good chance that the baby may implant maybe even in the first cycle. Now let me show you over here. This patient is under RFSH stimulation. We have gone for a stimulating dose of 375, and you can see that the size of all these balls over here, these are the follicles. I'll just put a small zoom over here. You can see that the size of all these balls is very even. So we call it an even cohort. An even cohort means if you go and measure the size of these individual balls or the follicles, you can find that the size is almost even, as in the size is almost the same. So over here I have just taken the sizes. You can see one is 10 mm and one is 11 mm in size. So in biology 10-11 mm is considered similar. You can make out that if you sit and count the number of follicles over here, there are close to almost 15 follicles in this ovary. So polycystic ovary patients respond very well to IVF stimulation as compared to the other types. This is a high LH polycystic ovary case. You can see, make out so many eggs are follicles are there in a line. You can see over here. So when we are aspirating this ovary, we'll be directly putting a needle, aspirating all of them out in a sequence. I'll show you this when we are doing the case in any further video. Let's put the vascularity. This is called the color box. When we put the color box, you can make out that the ovary is catching the blood supply very well, and we can almost assure that we will be getting some good luck from this ovary. I pray that we get good luck, but you can see that as a doctor we can never assure what is going to come out, what's the quality of the eggs, but looking at this color profile we feel that this is an optimistic ovary. This is the right ovary of the patient. Now I'll go to the left ovary. This is the larger ovary or the left ovary of the patient. This has almost close to 20 balls, that is close to 20-25 follicles, and you can see majority of them are of the same size. I'll just show you over here. I'll just demonstrate by measuring this. Again we have a small measurement over here, and here is the measurement that you can see. It's almost 10-11 millimeter in size. So this is a very even cohort. The way to get such a beautiful even cohort is to pre-medicate the patient very well. So we have treated this patient for almost a good 15 days to a month prior to going ahead with the stimulation, and you can make out over here that the blood supply of the ovary, the blood supply of the follicles is quite good. This is a rough estimate that tells us that this ovary is going to have good number of M2 oocytes that it is going to generate, which we can use for IVF. I hope today's video was helpful, and the patient stimulation is RFSH with a little bit of HMG, going to a maximum of 375. Thank you.